Hey, what's up, everybody? It's Dr. Jason Jones back with another episode of Health Made Easy. And today, what we're going to talk about is can you naturally minimize the risk of prostate cancer? And hang in there to the end because what I'm going to do is I'm going to give you a few tips that you can do to help yourself because it's probably one of the scariest things for men, and anybody is going to be cancer for sure. But I think especially for men is prostate cancer. It's a small gland. It's about the size of a walnut. It sits below the bladder, near the rectum. And it's positioned real snugly below the bladder. And even though prostate cancer is among the most common sort of malignancy that mainly occurs in men age 65 and above, it is still possible to develop early onset prostate cancer earlier in life, and men with such a diagnosis, maybe even between 35 and 55 years of age. So as the numbers continue to gradually increase in the last few decades, researchers believe that it could be due to a variety of factors, including things like a genetic predisposition. Even though prostate cancer can't be inherited, at least that's what I'm finding in reading. A man can inherit the genes that significantly increase their risk. Environmental factors like smoking. You guys see that as a common theme this month. Eating a lot of processed meats and meals that are dangerously high in bad fats. When fast-growing tumors in young men, and just being entirely missed by a screening, because typically men who are younger don't get that kind of a screening. So prostate cancer is a slow-growing disease that occurs when you have abnormal cells beginning to develop in the prostate, and they just continually to multiply uncontrollably to the point where they're spreading into nearby or distant parts of the body. Today, there are different stages and grades of prostate cancers. The most common stage is grade 3, and unfortunately, men with low-grade or low-risk cancer live for many years without presenting any symptoms, or without it spreading and becoming life-threatening. However, high-grade prostate disease spreads much more quickly and can be lethal, which is why early diagnosis is vital in order to help a patient or a person find appropriate management strategies. It is important to note that there may be no symptoms in the early stages. However, some of the common symptoms of prostate cancer in the late stages might be present in the following signs that we're going to cover. Even though you may not necessarily have this type of cancer, it is essential if you are having these symptoms to get medical attention and get it seen about for sure. Things like finding blood in the urine or the semen, frequent or sudden urges to urinate, weak urine flow, including trouble starting and being unable to urinate when the urge is strongly present, discomfort when urinating, pain in the hips, thighs, and lower back, and prostate cancer can lead to permanent quality of life affecting issues. And while there are no ways particularly to prevent the disease, you can reduce your risk by making some positive diet and exercise and lifestyle changes, including the ones I'm going to cover right now, which are things like consuming anti-inflammatory foods. And you can look up an anti-inflammatory diet. I like the Whole30. There's an autoimmune paleo protocol that's actually really great. Omega-3 fatty acid foods like seafood, flax seeds, walnuts, fish oils, those kinds of things. Avocados would be really good. A compound called lycopene, which you're going to find in tomatoes, grapefruit, watermelon, and apricots, have been found to reduce the risk of prostate, lung, and stomach cancer. And then just attending like a regular screening. Other things to avoid are going to be oils that contain a substantially high amount of omega-3 fatty acids, which are most oils, by the way, certainly conventional ones, high amounts of sugars and carbohydrates, and then high doses of grilled or fried meats. So there may not be a ton of things that you can do, but there are a few things that you can definitely control. And what you've noticed this month is there is a theme across the helpful tips and hints that I've given over the month. And you'll notice that some of them are very, very similar. So if you are doing those things and you're doing those things repetitively on a regular basis and you just make it a habit, you can handle and help yourself in so many different ways. So guys, seriously focus on your health. You're only going to get it once, and getting your health back is not only time consuming, it's expensive, because people always talk about getting healthy is expensive. No, it isn't. Being sick is expensive. It's way more expensive because half of all bankruptcies are due to medical bills. And you don't have medical bills because you're a super healthy person. You have medical bills because you're sick. Guys, take care of yourself. Keep it simple. Keep it easy. Practical steps. This is Dr. Jason Jones signing out, and we will see you guys on the very next podcast. Hope you enjoyed it. Bye-bye.